It's Cervical Cancer Month, and who else? Who else do we have in studio to help us shed light on this very important conversation? Dr. Oum-Kalsoum Adam. Happy New Year to you.
Happy New Year to you too.
Jude
and
you abandoned us the festive season, but it's fine.
Which is usual of dog. I don't
Yeah.
know where she vanishes to. She needs to tell us.
It was just a week.
We still felt abandoned.
It was just a week. Yeah. Anyway, Doc, I hope you are well.
Yes, I am. Thank you.
Cervical cancer is something you talk about even when it's not time for its awareness month creation.
Yeah.
So I can imagine the energy you have for it this time around.
Yeah.
Why is this so important for you? I get the sense that it's something that affects a lot of people. People living late for treatment, hence the need for awareness. But why are you so minded about it, particularly as a public health advocate?
Okay. All right. So cervical cancer, being a woman, may be number one. And then secondly, the fact that we are a part of MWAG, which is Medical Women Association of Ghana. And cervical cancer, its education, its awareness is one of the very important health issues that we really pay attention to, because we are women. We're a group of lady doctors, and who else would be the best to be able to advocate for things that do affect women? Because once you're a woman, when you are talking about it, it reaches out to people better. People, you can actually identify with it. You would be able to give them or bring out some of the things that they may understand better. And also you would be able to understand them better. So it's one thing that, in fact, this advocacy has been on for over 11 years now when it comes to with MWAG, Medical Women Association of Ghana. And cervical cancer, it's a very preventable disease, very preventable. And it's killing a lot of women as well. That's the irony.
Would you say
something
it's one of the
that
most
is
commonest?
Yes, so I would say about the second commonest in Ghana. Okay, so it's...
Which is first?
So depending on the country,
Okay.
whether, I mean, in the developing countries, breast cancer is there, and then you also have cervical cancer. But that's, you can't even really say for sure, because most people, these are the numbers that you have, that have been reported. But imagine the numbers that have not been reported and have led to deaths. So those numbers have not been captured in the statistics that we are dealing with. So really, it's cervical cancer and I say breast cancer are usually either number one, number two, or number two, and then number one. So depending on the country and then the statistics that has been recorded. Okay, so it's a highly preventable disease. And imagine something that can be prevented, and because of ignorance, because of you not knowing about it, you end up having the infection, and then the infection causing the changes, and eventually end up with a cancer that has spread and eventually leads to your death. It's actually very, very unfortunate. It's an unfortunate death. So that is why we would want to throw more light, speak about it, let people know about it, and especially because of our cultural setting, where a lot of people do not want to talk about anything related to their reproductive health. Anything related to the vagina, to the cervix, and all of that, people do not want to talk about it because of how we are brought up. Yeah. And also because of the fact that the cervix is hidden. It's not like your breast, which is ovate, is out there that you can see, but the cervix is actually hidden down there. And if you don't talk about it, you don't educate people, people will not be aware about it, and they may end up having the disease at a stage that you can't actually do anything to save their lives at the time of presentation. So we'll go on to talk about what the cervix itself is, because people, maybe I'm sure some people know, but others too may not know what the cervix is. So when you say the cervix is basically a little area that is that connects, so it's like the mouth to the womb. or the uterus. Okay, so that little area that connects the vagina, okay, at the lower portion, and then the uterus on top of it. Okay, and usually the cervix is, most of the time it is closed, especially when you are pregnant. It is held very tight. It's shut so that it holds the baby and the baby doesn't fall out. And when you're in labor, that is what opens fully so that you can push out for the baby to come out. So this little area is what we are talking about. And it usually protrudes through the vagina. So anytime, and that is why when we say HPV, which is the leading cause of cervical cancer, which is an infection, anytime you have maybe a sexual intercourse, it means that the vaginal walls are opened and then the penis goes in there and the cervix is protruding. So that is what would get access to whatever fluid that's there or whatever infection that is there, and then lead to the infection and eventually lead to the cancer that we are talking about. So this is basically what the cervix is. Now, when we say cervical cancer, what do we mean? We mean that when you have the cells of this cervix, so this cervix usually has cells, and these cells, we have something we call the DNA that helps with what? The proliferation of these cells in a controlled manner. So it's controlled. So it grows, your cervix is able to shed, it divides in a controlled fashion, and then the cells end up dying, and then you have new ones forming. But we say cancer when you have something affecting the growth of these cells, such that now it causes mutation or it causes changes in the DNA of these cells. So the DNA is what helps you, it gives you the command, okay, go and then divide into this and all of that. But then that control is mutated or is taken away, such that now the cells would uncontrollably divide. So they divide, and then after dividing for a very long period, they cause or a cancer forms or a tumor forms. And this tumor can be confined in that cervix, or it can move to other parts of the body. You get it? So in that sense, you see cancer has formed. But it's a very long, the irony is that it takes a very long time before you get this cancer forming. So first of all, you have normal cells. Now these normal cells, maybe through your daily activities, through sexual intercourse, you tend to have an infection. So this HPV, you have a lot of them, a number of them. But most of the time when you do have an HPV infection, it clears on its own after a period. But then if you are infected with the high risk ones or high risk strain types of this HPV, then it means that it would stay on. So from a normal cell, now you have an infected cell. Now that infected cell will then will start forming changes. The HPV will start causing changes within the cells. And these cells will now become dysplastic. Then those are the changes that we are talking about. And then eventually, if it is not caught over a long period of time, so this long period of time I'm talking about could be about 10 years, it could be about 15 years, okay? And if it goes on throughout this period, then you end up with the cancer that we are talking about. And it is highly preventable because these changes, remember, as I mentioned, these changes take time. And if you are doing your regular screening, you should be able to catch these changes very early and then give the right treatment so that it doesn't move from normal to precancerous lesions to the cancer that we are talking about in the long run.
HPV.
Yes.
I'm assuming we're getting it from the men?
So it's sexually transmitted. So it's, yes, so human HPV is basically human papillomavirus, and it is sexually transmitted. So you have about, let's say, the high strain ones. You have high risk HPV strains. You have the 16, you have the 18. Okay, so the 16 and the 18 is just nomenclature to be able to tell you that, okay, this is, to be able to tell that this is the particular type of HPV that we are dealing with, okay? So over 95% of cervical cancer is actually caused by HPV. Okay, the high-risk HPV types. And out of that, about 70% is caused by the strain 16, and then the strain 18. We have the low-risk ones as well, which you say the commonest ones are the 6 and the 11, but they cause growths or warts. You remember the last time we spoke about genital warts and all of that. They are responsible for that. And this HPV can cause not only cervical cancer, so depending on where the infection is. So it can cause oropharyngeal cancers that's within the mouth, in the throat. It can cause anal cancers, penile cancers, and then others as well. So depending on where it is, you can end up having cancers happening in those areas. So the men do not have services. Okay. But then, if they are infected, they may end up with what? Penile cancers. People who end up because of their sexual orientation.
Which is less common than the prostate.
Yes, it's less common. So if it ends up affecting maybe your anus, okay, so you end up with anal cancer. Okay, if it's in the mouth, okay, you end up with oral cancers or oropharyngeal cancers. So depending on where it is. So yes, basically, we say that it is sexually transmitted. So because of the percentage with it, about 95%, would say that most of it is from having being infected from it through sexual acts.
In as much as women are supposed to get tested periodically, for cervical cancer, what would you say about men? Because if it's a sexually transmitted disease, and I'm assuming that HPV is very difficult to find on men.
Yes.
How talk us through that.
So that would also come with if they have symptoms. So imagine if it's the high-risk ones that they do have. If it's causing penile cancer, there will be definitely an ulceration or a sore on the penis. Okay, if it is affecting the anal region, the same thing. If it's affecting the oropharynx, most of the time they tend to cause these changes, dysplastic changes. So you see a sore, there may be a sore there, and then when you take a biopsy of it and then you run your PCR, you'll be able to tell that, yes, they do have the infection of the HPV. So these are some of the ways, depending on where the infection is, you would be able to do the relevant tests depending on that to be able to tell that, yes, this patient really does have HPV infection. And you have to marry it with the history of the patient, definitely. So having the sexual history of the patient and all of that. So this will actually bring us to some of the risk factors associated with it. So risk factors mainly would have to do with you having multiple sexual partners. Multiple sexual partners, okay? And then sometimes it's even you having a partner who has multiple sexual partners. So not necessarily you having the multiple sex, but the partner that you have has multiple sexual partners, okay? And then people who may have had certain STIs already. So if you already have a sexually transmitted infection, it reduces your immunity, such that now when you do have the HPV infection, it reduces your chances of clearing the infection, especially if it's the high risk, and then this can end up developing into cervical cancer.
Okay.
Another could be that our good old HIV, if you do have HIV, it also reduces your immunity. Others are if you do have any other cancers within your body, that can also reduce your immunity and then reduce the rate at which you can actually clear this infection. And then if you have family history, so family history of somebody in your family who may have had cervical cancer before, it also predisposes you to having higher risk of developing cervical cancer. And then the early coitus, so the first time that you may have been exposed to sexual intercourse, if it's at a very early age, it means that if you are not screening, that means that, assuming somebody, their first sexual intercourse was at about age 18, as opposed to somebody whose first sexual intercourse was at about 25. So if you look at the 18 and then the 25, The difference is about 7 years. So for 7 years, this 18-year-old, since he or she is sexually active, has the higher chance of developing cervical cancer because of exposure, as compared to somebody who has had her first sexual intercourse at 25.
Right.
You get it? So that is also a risk factor for developing cervical cancer. But really, it's very important because sometimes, and it's very important that we know about it, because sometimes you having either the infection or the precancerous lesion may not come with any signs and symptoms at all. You may not know, you may not have any signs and symptoms at all. So that is why the emphasis is on what? Screening, having the right high performance screening test for the right age at any point in time. So some of the signs and symptoms associated with cervical cancer may be, as I mentioned, no sign or any symptom at all. Another could be if maybe you have the overt cancer, you may end up with bleeding, abnormal bleeding. So abnormal bleeding, let's say intermenstrual bleeding, so you bleeding when it is not the time of the month, or you having bleeding anytime you have sex. So we call it postcoital bleeding. So that can also be, or you can have some foul smelly discharge, depending. So remember I said that the cervix actually protrudes into the vagina. So with all the pictures that we are showing on the background, with the growths, so you notice that if the penis hits on these growths, which is very friable, that is what would break off, and then eventually you end up with bleeding that the patients may present with. And also, depending on the staging, you notice that sometimes it can affect other surrounding organs. So depending on the organs that it affects, and also because of the bleeding, patients may have signs, constitutive signs of what? Anemia. So they may easily become fatigued. Okay, they may be emaciated because it's a cancer. If it has affected the bones, it means that they are at risk of developing pathological fractures at any point in time. So depending on the staging, then you can have additional signs and symptoms. If it has gone to the lungs, then you end up having symptoms associated with the lungs as well. So depending on where it has spread to in the staging, you'd have certain signs and symptoms peculiar to that system. So in a nutshell, I think we have spoken at length about what the cervix is.
Yeah.
And when we say cervical cancer, what exactly cervical cancer is. And January is actually a month, that's a whole month that has been dedicated to awareness.
Is it a global thing?
Yes, it is a global thing by WHO. And for us in Ghana, especially Medical Women Association of Ghana, we do a lot of these educational talks across the country. So from Northern region to Ashanti region and all of that. And then we also have this collaboration that we have with Lexter Ghana, where we provide at least 100 women in each region. They get to have the test done for free, okay? So that if you haven't had your screening done, then you can actually look for the nearest Lady Doctors Association in your region, and then make sure that you are part of the 100 people who would be screened for cervical cancer.
If anybody is watching and they want to support the Medical Women Association of Ghana, are you open for such support?
Yes, we are. We are very much open for that support, and they can actually reach us out. I'm sure I can leave my number. Being the National Secretary, yes, they can reach out to us so that we can reach more women out there, and then through education, through screening, and then follow-ups as well, so that they get to know what cervical cancer is. Highly preventable disease, highly preventable cancer. Unlike breast cancer that is caused by several things, several multifaceted factors coming in, at least for cervical cancer, you know that 95% is from HPV infection. And if you do your regular screenings, you should be able to catch it early so that you don't end up moving from infection, precancerous lesion to the cervical cancer.
Doc, I want you to quickly run us through the screening and what goes on when you lie down and your legs are
all right.
Because
all right.
most women can't fathom that they have to go through that.
Okay. All right, sure. So the screen, I'm sure we'll do another episode for just screening, but I can just do a quick run through it. So the screening, there are different types of screening. So we have the VIA, which is visual inspection with acetic acid. And then we also have the pap smear. And then we also have you doing the HPV, the HPV DNA code testing, as well. So there are a number of them. So the first thing is that if you have to have the screening, you shouldn't be in your menses as a woman. So these are the little preparations. And you don't need to do any douching, please. Some people douche and do all sorts of things, put all sorts of things and no. So at least if you are into such acts, please stop it at least 48 hours to your test so that you don't end up causing any causing any alterations to the region that the test needs to be done. And then the other thing is that a speculum needs to be passed. So a speculum, I'm sure on our subsequent I'll show what a speculum looks like. So a speculum needs to be passed because the vagina in itself is not opened. Okay, there's an anterior wall and a posterior wall that is usually are closed on each other. Okay, so you need that speculum to go in there to open up the vagina so that you can visualize
I'm sure.
So then you can visualize the
cervix. More in
cervix.
In subsequent editions, like you rightly said. Doc, thank you so much. We'll be following. Already, people are asking for the number, but I don't want you to mention it. You know, when you mention it, people will start reaching out for
the wrong reasons.
Other reasons you can't endorse. Anyway, thank you so much for your time.
Thank you too.
If you want to support